As we all know, that autism is a condition that affects how a person communicates, interact with others, and how they experience the world around them. In this interview, we will be discussing the importance of early intervention of autism, especially in children. Thanks for joining us today. I would love to start with a big picture question on how do you define early intervention?
Thank you for this question. We will talk about autism spectrum disorder. We will talk about the importance of early intervention for autism spectrum disorder. It's very important to highlight that autism spectrum disorder is not a disease and it's not acquired. It's some disorder that the child is born with that's predominantly linked with genetic predisposition at the moment. There are risk factors with developing autism spectrum disorder, such as early adversities at certain points in pregnancy or during delivery or early, very early infancy years or times. There is also the maternal and paternal ages, and also whether it's too old or too young. Now, talking about the importance of early intervention utilizes a feature of the brain called neuroplasticity. Neuroplasticity means the young brains before 5 years are malleable for changes. They can adapt, they can learn, and this can, while it does not cure autism, it helps the child learn new ways to connect with its environment, to connect with his peers, to connect with his family, to achieve his potentials, to learn skills, to do things and enjoy life. The importance of this to happen between, whenever we get the diagnosis to 5 years, really is all about this neuroplasticity. If we give an example of two children who came at the same time to the same doctor and had the same symptoms and were diagnosed with, say, level 2 autism, then they were followed up for 2 years. One of them had all the early intervention and the other one didn't have this opportunity, whether it's because of social reasons, family reasons, or just resources. If we follow those children up, we will come to see that the child that gets early intervention is more likely to be able to do more in his life, maybe even go to school, maybe develop a skill or a certain hobby, and is usually generally happier. Whereas the child who does not get early intervention opportunity is likely to struggle with his repetitive behavior, his interest being very restricted. He's more likely to develop some unhelpful coping or behavioral styles. He might become destructive. He might become amotivated to do things, and that is really the difference, So we are really setting children to success with teaching them how to do things and how to find joy and interest very early in life.
What are some of the barriers that you face with people who have, or children who have autism?
Well, barriers can be outside of family control. Barriers can be within family control. Barriers that are outside of family control will be definitely, where to find those experts, how to navigate through the system. It's very difficult for some families who aren't resourceful, who come from linguistically and culturally diverse background, to navigate through the early intervention system because they just don't know where to start. They worry about the child, they don't know who to talk to, they don't know where to start. The worry about the diagnosis itself brings other problems within the family that are the avoidance. Some mothers come to clinic and they tell us that, we didn't go early because we were worried that they will be diagnosed. And we just thought that he will get better, and and that kind of took on very long. And at the end, we find ourselves quite late for the intervention. So parents' anxiety, the resources of where to start, the confidence of the doctors who see them are all very important things in really setting this child for the right journey. There are also factors that are outside of parents' control, such as the child's IQ, their level of intelligence, this is not autism. So how the intellectual disability, what we call, is another problem that comes with autism at times. But when it comes with autism, it might limit the journey gains for the child, where the parents have done what they need to do, they have taken the child, they have started the journey, but the child is really not going in the same way because their intellectual ability is not as much as is a barrier. Other times there are other sort of comorbid, we call it, like things that happen with autism, like ADHD, attention deficit disorders, that complex trauma, the PTSD people call it. These are things that can come with autism, but can also limit the gains, and they need to be addressed hand in hand to really overcome that as a barrier for the child to learn and get to their potential.
If you would give one advice to doctors who specialized in autism and families, what would it be?
An advice that I would give to any professional for looking after children with autism would be to try to listen to the child, listen to the family. It's not about the diagnosis. We are fortunate to be living in a country where getting the diagnosis has a clear pathway, and sometimes the parents come and they know the features are very strong, they are striking, and the parents know that it's very likely that the child will have autism. It's very important for the clinician to listen to the parents and understand their doubts, understand their anxieties, understand their strengths and their barriers, because after all, the child has autism, but the parents are looking after the child. And we need to look after the parents so they look after the child for us.
Speaking of families, how would you engage them when they seem unknown or unsure about the importance of early intervention? For example, if they experience lack of knowledge on the importance of early intervention.
Some of the important barriers we face as clinicians looking after young people on the autism spectrum in the early intervention space is the stigma. Stigma is very inherited. It gets passed on from one generation to the other. Families might come to you thinking that autism is a form of like a mental retardation, or they may think that it's a form of madness. They may think that the child will never be able to learn, that the child will never be able to be independent, that the child will become aggressive, or he also has a syndrome or another disability that prevents him from becoming an active contributor in the society. This will lead families to become withdrawn, to become resistant to early intervention, and really needs to be understood and needs to be addressed with the families. Another thing is the lack of awareness. Some families haven't even heard about what autism is, and when they come in, they might have heard it in the news, they might have heard it as a word of mouth, but really what it is complete mystery to them, and it needs to be unpacked, and they need to understand what it means and before really overwhelming them with what needs to happen. So a session or two just to take them through what it means for your child to have autism, what it means for a family to have a child with autism, and what needs to happen might really help the process become a healthy process. The other factors will be some of the disadvantages that the families face, such as domestic violence within the home, financial difficulties, other social barriers such as having a number of children or are high care needs or with multiple behavioral difficulties or medical difficulties that makes it overwhelming for the family to attend to support their child early on in the most effective way.
Thank you very much, Dr. Dina, for your time. It's been a pleasure hearing your perspective.